cat. Introducing my cat.
Dog. Welcome to our Midnight Mental Talk. We're back with Adrian and I'm Leanne. If you want to know more about us, check out our first video where we did introductions and we talked about depression and got into cognitive behavioral therapy, which is where our conversation is going to continue this evening. Adrian?
Yes, as Leanne said, we're going to continue talking about cognitive behavioral therapy, which it's very extensive. As I tried to do research earlier today, and there was lots and lots of information out on it. So much information out on it. Anyway, last week you had mentioned that a therapist had told you that it was an alternative to medications.
Mm-hmm.
However, one of the articles that I read says it may be tied up with medications as well as by itself.
Oh, good.
So, yay! I wasn't like pulling that out of the air.
No, good. You've confirmed that. Awesome.
I also learned that it helps to boost your happiness, which kind of is funny to me because like it's not just to help you boost your happiness, but it's also to help develop other skills with life.
Mm-hmm.
So the way I had thought about it was, you know, how you're trying to quit smoking and you're quitting smoking, but you're smoking for reasons like anxiety or because you're bored. So you're trying to replace bad negative behaviors with positive ones. So that's kind of how the cognitive behavior therapy is. And it's actually kind of, yeah, it's an extensive work. And also, when I looked up a timeline of how long it would take, it said that it could take a couple of sessions or it could take several months for it to actually work.
Well, yeah, no, that was the question I was going to ask you, is how long you thought it would take for, and I guess it really is on an individual basis.
Mm-hmm.
Okay.
Yeah, and it's actually, I had looked up the difference between clinical and situational depression, and it had said that it could work for both,
mm-hmm.
which is also a positive thing to hear because you would think, I think probably in common consensus of people of the general public probably think that it might only be good for situational depression, but they said it could be worked hand in hand with both, so
okay.
That's not so bad.
So what else did you find out about this therapy that people might want to know before giving it a try?
Definitely take time. Not everybody's going to be successful in a month, but it is actually a weekly thing. It's not like you go to the therapist once a month. It's actually weekly. Mm-hmm. And expect homework. You won't be given homework.
That is what I'm looking up right now, actually, to give you a sample of. Basically, when this was back in September of 2009, so we're going back here, but basically the homework that I was doing at the time was like, I don't know what you can see there, like it's like a list, a checklist of automatic thoughts, which is your self-criticism, like you say something, oh, I can't do this, or I suck at this, or whatever, and then you have to recognize they try to get you to learn the cognitive distortions. Then there's 10 different types of cognitive behaviors that you need to learn to recognize, and then you have to associate it with your automatic thoughts. You also have to give your rational response, so like your self-defense to your self-criticism. And basically this chart that I'm doing, or did it back in 2009, came from the book, this book right here, that one. And the chart is actually on page 62. That is where I got it. It was recommended to me by my therapist. But yeah, no, it's a chart. It's giving you, it's exactly what I did there. So yeah, so you're right when you say there's homework. That's an example.
There was also a list of steps to take, which I guess is more, I think the steps when I was finally actually read it over again, it was sort of focused on the person who is giving the client the information. So I think it goes hand in hand with the therapist and the client. So I think it works out both ways. And the person, there'll be a reference somewhere in these lovely videos at some point to show you that I did just pull it out of the air. So This one has 7 steps, and I'll try and break it down as small as possible because I ramble even in my notes. Step 1 is for you to set goals and explain to the therapist why you're there and what they can do to help you. Remember to revisit the goals periodically throughout your therapy session. That way you don't get off track and forget why you were there. Step 2 was start each session with an agenda. When you go into your session, elaborate on what you want to focus on that day, as opposed to like, oh, well, we're just going to blow things off the charts here. Like, you're going to talk about how you moved toward the last week and review the topic from last week and figure out certain steps to take. And also, you should follow up on last week's homework, which I think I already said, but that's okay. What to elaborate again? Step 3 was to discuss where to address the issues, and I had written down that you should discuss with your therapist on the level to address the goal. For example, if you're discussing distorted thoughts, like you had mentioned, it's important to pin out what thoughts and images occur when you're having them, which will lead to distress and anxiety. So you can discuss on different steps on how to redirect those thoughts at the time of the certain situation. Step 4 was use flashcards, and it's actually kind of funny because the first thing that popped into my head was university tests and exams. Like, why would you use flashcards? Well, you might want to remember what you learned in class or you learned in your session, so you can go back on it the next day, like, well, I had this anxiety moment on this certain situation at the store, so what should I actually do? So you can flip through your cards and find out what you and your therapist had come up with. Step 5 was obviously stay focused.
There you go.
And it to keep you on your path of trying to figure out how to be happier and more focused. Yeah. Flexibility is important too, but just I think when I read about the flexibility, it was just kind of like so you can go back and revisit what you were talking about and what your goals were. So obviously you have to have the structure, but you can't be too rigid as well, or you just you might lose interest in why you were there.
Okay.
Step number 6 was, as we already discussed, you'll be assigned homework. Homework! Gotta love homework. And number 7 was definitely ask for feedback with your therapist, and your therapist will ask for feedback from you as well, because they'll, they need to know if you feel like it's working, and if it isn't, then you guys will have to discuss on what isn't working, and maybe you can figure something that will work in this therapy. And effective with or without meds! Yay! Yeah, so that was my really quick ramble, and if you guys didn't get it, just ask me and I will write it out for you instead. Because I talk really quickly, as you'll learn.
Some books that I wanted to recommend to people, that may be thinking about doing this cognitive behavioral therapy stuff, or just to read in general if you're in this type of situation and whatnot. There's also a book called Reinventing Your Life by Dr. Jeffrey E. Young and Dr. Janet Klosko, and I do apologize if I don't pronounce those names right. And the other book I wanted to recommend, what I already mentioned earlier, is the Feeling Good book by David D. Burns, who's also a doctor. It's called Healing Anxiety and Depression. It was also written by a doctor, if you wouldn't have guessed. You can find those at, I believe, Chapters or any kind of bookstore. They weren't hard to find for me. So those are books that I recommend to go hand in hand with the cognitive behavioral therapy stuff.
Well, now I have some research to do myself.
Aha!
I'll have to find some more books. Yeah, I think I pretty much covered everything that I wanted to. It said the process focuses on solutions and challenging distorting cognitions and to change destructive patterns of behavior. I personally think cognitive behavior therapy could be really good for, say, post-traumatic stress, because that way you can take it and when you have something that triggers a flashback, then you can probably work your way through it when you do use this therapy. Yeah, it really is good for anything, and so I would definitely give it a shot. If so far you have done everything else that the therapist has suggested, and you guys haven't done this, go to your therapist and ask them about it, and maybe it's something that could work. It doesn't hurt. It will take some time because it's like taking a bad behavior and turning it bad habit and turning it into a new one, a good one.
Mm-hmm.
It just doesn't happen overnight. So it's like taking a junk food addict and telling them, hey, look, you're gonna have to eat vegetables for the rest of your life. Chances are they're still gonna go for the junk food because that's what they're used to and that's the habit they have created.
Click like, subscribe, or comment below. And if you want a certain topic discussed, please email us at midnightmentaltalk@gmail.com. But on our channel now, you can go directly to both of our Twitter pages. Our topic next week will most likely be about anxiety or suicide. You'll have to tune in to find out.
Yeah, exactly, because you never know what we're going to pull out of the air this time.
It was good chatting with you this time, and I look forward to our chat next week.
I look forward to it as well.
All right.
Bye!
Bye!